Hello. Today we'll be deliberating on the types of diabetes, treatment, and prevention of diabetes. However, before I go straight off into it, first we must ask ourselves, what is diabetes? Well, diabetes is a lifelong disorder from the lack of insulin in the body. It mainly revolves around our body not being able to produce enough levels of sugar. There are two types of diabetes, type 1 and type 2. The majority of the people with diabetes have type 2, due to the stemming of hereditary and being overweight. Nevertheless, the first steps to determining if you are diabetic is through tests. There are two types of tests that can be taken to diagnose if a person has diabetes. They are the urine and blood test. With the urine test, the patient urinates on a paper strip that will change colors to the amount of sugar within the body. The urine test also searches for ketones within the urine. According to the Health and Wellness Research page, ketoacidosis can be a life-threatening situation in type 1 diabetics. The dipstick test also searches for protein within the urine, which can lead to other bodily failures and problems. Then there is the blood test. For the blood test, there are multiple ways to be diagnosed. Probably the most important and the most recognized is the finger stick. The finger stick is aired on commercials with diabetics pricking their finger and drawing blood into a portable device. What this specific test does is it searches for patients' glucometer or sugar level to determine whether further treatment needs to be initiated. Still, urine and blood tests are the first steps to determining if a person is diabetic. There is also a multitude of treatments for diabetics, from traditional diet and exercise to drugs and surgery. Usually, when a diabetic patient goes the traditional route, they must maintain a diet with meals all being the same size. This will help regulate the body's level of blood sugar. Now, with eating comes exercise, and a diabetic must exercise to prevent other bodily failures like leg ulcers or even a stroke. After all, the main goal in traditional route is to help lower the blood sugar levels. However, there is still the alternative way of lowering the patient's blood sugar. The first would be prescription drugs. Medications from anti-anxiety to aspirin can help a diabetic in various ways. For instance, it can help lower the chances of heart failure. It can also slow down the person's eating habits or digestion. Then there is surgery with transplants and artificial organ insertions. Mainly the surgery focuses on pancreas and kidneys, seeing that this is where the insulin is created. But hospitals and health networks say that surgery should only be the last resort. Therefore, in order to keep from obtaining type 1 and type 2 diabetes, we need to know how to prevent it. The steps of preventing diabetes are simple and easy. Basically, you just need to live a healthy lifestyle, which entails eating balanced and healthy meals to keep your blood sugar levels regulated. Keep an active lifestyle with exercise, even if it's only walking instead of driving, can help lower the body's blood sugar. And lastly, you need the knowledge of what diabetes is and the different ways you can get it. The knowledge you obtain about diabetes can help you understand and how to prevent from getting it. With all of these in mind, we can help build a healthier world. There are plenty of ways and methods to see if you have diabetes, just by doing these tests. There are also different methods to treating diabetes, whether it be the old traditional way or the new alternative way. Now, the ways of preventing diabetes are simple too. Just keep an active and healthy lifestyle. With this being said, fighting against diabetes and all the negativity it brings, should be really easy.